Hey, I'm Dr. Michael Lange. We want to age as gracefully as possible, don't we? So is there enough evidence out there that proves that certain specific nutrients, ingredients, or supplements can enhance, our skin, our joints, our hair, our nails? And there's a lot of great science that's come out recently with marine collagen tripeptides, riceramides, hyaluronic acid, and there's a new supplement called Dermaval. Well, we've taken all four of those and we've combined it in a supplement called Rejuvenate. 3 delicious flavors, chocolate, cherry vanilla, pink lemonade, and then we have it unflavored for those of you that want to just put it in your coffee in the morning. It's worth a try. I endorse it, obviously, 100%. If you don't like it, we'll give you money back. It's as simple as that. So check it out at Fortifeye.com.
The Doctor with Dr. Michael Lange. Sponsored by Lange Eye Institute and Fortifeye Vitamins. Dr. Lange is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The Doctor is in. Call now with your questions at 813-282-8283. That's 813-282-8283. Here's your host, Dr. Michael Lange.
Okay, good morning and welcome to Ask the Doctor. I'm your host as usual, Dr. Michael Lange of the Lange Eye Institute and Fortifeye Vitamins. I have to answer any and all questions you may have regarding your vision, eye care, or a nutritionally related topic. I've been hosting Ask the Doctor since April of 1993. We're officially the longest running live medical talk show in the United States. So that's been a while, all right? And the whole caveat here is live. So there are some talk shows that have been going on a little longer, but they're not live. This is, like I said, live, so you can call us at 813-282-8283. That is 813-282-8283. If you're new to the program, we're broadcasting coast to coast on the Ask the Doctor Network and live video streaming all over the world. So it's good morning, good afternoon, good evening, just depending on what part of the globe you're watching or listening. And my co-host now for many years is Dr. Susan Summerton. Dr. Summerton, good morning. How are you? We'll try to retrieve Dr. Summerton in just 1 second. Anyway, I'm going to give you the phone lines one more time. 813-282-8283. And I am a board-certified optometric physician, a certified nutritional specialist. And like I said, I founded Lange Eye Care & Associates March 15th of 1993. We opened 14 locations in 3 LASIK centers in the state of Florida. Opened the Lange Eye Institute about 20-some-odd years ago. And Fortifeye Vitamins about 25 years ago. And you can learn more about Fortifeye Vitamins at Fortifeye.com. Fortifeye.com. Fortifeye Vitamins, our slogan is right ingredients, right science, right for you. Okay, we're going to go back and see if I can retrieve Dr. Summerton. Good morning, Dr. Summerton.
Good morning, Dr. Lange. I'm calling in from the Villages today. It's a beautiful day, and we're looking forward to a great show with all the listeners, and we're here to answer any questions that you have today.
Excellent. And we are live in the studios. Today is Saturday, June 7th, 2025. Saturday, June 7th, 2025. Last week, we did run a tape. We were at the American Society of Nutrition Conference, learning a lot more about nutrition and anti-aging, and Fortifeye Vitamins was one of the sponsors, so we had a booth set up, and we had doctors from all over the world and nutrition gurus from all over the world that I had the pleasure of speaking with. I was just about out of, my voice was just about gone. I must have spoken to probably a couple of hundred doctors and nutrition gurus. And then this week, yesterday and this week, we have Fortifeye Vitamins is sponsoring the Optometric Education Consultant Conference over in Disney. And we were in Orlando at the big convention center the week before. So my Fortifeye Vitamin team is over there right now. I decided to come in town so we could host the show. We can't have 2 tapes in a row. And I also want to take this opportunity just to wish, well, first of all, yesterday was D-Day, over 80 years ago. Remember, 1944, it was the biggest seaborne invasion in the history of the world in Normandy, France. I think it was June 6, 1944, World War II. Over 10,000 deaths. And I want to thank really the entire military and everybody that served, everybody that's fought for our country and fought for our freedom. So thank you there. All right, we got all that done. Now we got some people on hold. Let's go to Susan in Ocala. Susan, good morning. Welcome to the program.
Hi, Doctor. Thank you to you and Dr. Summerton for all the information you give everyone in health.
Thank you.
So,
Thank you.
anyway, I'm calling for my brother. He's out of New York, and I'm down here in Florida. And he has severe dry eye and glaucoma that's controlled to the pressure of 11. And I told him all about you, and he wants to order macular defense and focus, but he was asking me about that zinc test, that DNA zinc test or something. I never even heard of it, to figure out whether you should order macular formula with zinc or not.
Yeah, so if you go to the website at fortifeye.com and go to the macular defense vitamin, I have 4 questions that you answer to help figure this out. So the 4 questions are this, and this is based on years and years of recommending supplements and DNA studies we're involved in with macular degeneration. So there's 4 questions I usually ask the patient. Are you a vegan? All right. If you're a vegan, you need extra zinc. So you need the Fortifeye Macular Defense, not the zinc-free one. Okay. Do you have,
he's not.
all right. Do you have ulcerative colitis or Crohn's disease? Then you probably need extra zinc. If you're an alcoholic or drink more than 2 glasses of booze at night, you need the one with zinc. And then if you're on a diuretic, all right, you need the one with zinc. And if he's not answering yes to any of those, then I would get the zinc-free one, because you get plenty of zinc in the foods that you're eating, especially if you're eating animal proteins. So I would go the zinc-free. And if he has dry eye, have him look at our advanced dry eye therapy kit. It's called Advanced Dry Eye Therapy, and it comes with the Focus, the omega-3, and black currant seed oil all in one box at a dramatic discount. It's really pretty affordable. And I think that would be beneficial. And if he has the macular defense, this is multivitamin, eye vitamin, and the advanced dry eye therapy from a nutritional standpoint, as long as he adjusts his diet and exercises and gets a good night's sleep and plenty of hydration, at least he'll be getting everything he needs from a nutrient standpoint.
Okay, that sounds great. And trying to get him to come down and visit me, and then he could make an appointment with you.
That would be ideal.
Yeah. So again, thank you so much for all the information. I'm sure he's listening to you right now. So, okay.
Awesome.
Have a good day.
Thank you. And Dr. Summerton, it is so important, and you and I both being nutrition specialists, we know the importance of proper nutrition, proper diet. And one thing that we talk with our patients, and most eye doctors don't, is about adjusting their diet. Isn't that correct?
It is, because we are a full believer in supplements. However, it's not a substitute for proper diet. And so that really is the hallmark, the basis of everything, is making sure you put more of the good foods in and less of the bad foods. And we understand it's very difficult to do that, and it takes a lot of effort. And even if you get the best of the best produce today, it's really hard to get the quantity of nutrients that we call to have a therapeutic effect. So, for example, with the lutein and zeaxanthin, it's really hard to eat that much kale, that many greens in your diet, that many of the orange vegetables, to get the amount that we need to get into your eyes to be stored in the macula to protect it. So we want you to have that basis of the fruits and vegetables, the protein in your diet, and then therapeutically boost it with the supplements there. And we've taken a lot of time to make sure that the supplements are able to be absorbed, because that is a big thing. You can take supplements, but you don't know if they're what we call bioavailable. And we need to make sure that what you're taking is going to be able to be absorbed in your system. Otherwise, you're just wasting your money on these supplements. So there's a lot that goes into it, but at the same time, we love doing that research behind it. We actually, both of us, we talk about it pretty much every single day. And so it's just a passion of ours, and we're just really happy that we can learn about it and then share it.
Absolutely. And that brings up kind of a valid question that people are probably thinking. The question is, should I take a multivitamin or not? And Dr. Summerton kind of, just touched on this. There's a lot of multivitamins out there that aren't based on any science whatsoever. They're filled with dyes, binders, fillers, artificial this, artificial that, and then only window dressing amounts of nutrients, enough to get label claim. All right. So an example would be 0.25 milligrams of lutein, not enough to register in your blood, not enough to move the macular pigment density in your retina at all, but enough to be able to put on the label. So you got to be careful with multivitamins. So my opinion today is if you're not eating enough fruits and vegetables, there's direct science out there that shows if you eat a minimum of 5 servings of fruits and vegetables a day, you have less disease. You really do. So if you're not getting at least 5 servings, preferably organic fruits and vegetables a day, and a lot of you are on these specific diets. Some of these are crazy diets where you eat absolutely no fruits and vegetables. One is the carnivore diet, the old Atkins diet. And so these people, I think, definitely need to take a good multivitamin. Many people are not only restricting their food groups, but restricting their calories just to lose weight. And therefore, they're losing muscle, and they're becoming unhealthy because they don't have any antioxidants or phytonutrients in their system. And we're also eating foods on the SAD diet. That's the standard American diet, which is overly processed and void of the majority of nutrients. I call them empty calories. And many of us are taking medications that may delete vitamins. And then once again, a lot of us are overly abusing alcohol, smoking, drugs. Things of this nature that also depletes nutrients. So if you fall in any of those characteristics, then absolutely a multivitamin may be a very good idea. But the problem is, like Dr. Summerton just mentioned, a lot of the vitamins you buy over the counter are not ideal. So we have developed a supplement years ago called Fortifeye Complete Advanced Nutrition. And we've changed that formula 17 times over the last 20 years. It goes and it follows in the footsteps of Fortifeye Macular Defense. It's just a tad weaker, but it's the same exact basic ratio. And you take 1 to 2 a day of these, depending on your size and your weight. Most of us are going to benefit from 2 a day. But it's called Fortifeye Next Gen Complete Advanced Nutrition. It's a multivitamin and an eye vitamin all in one. And like I said, it's 20 years of research, 17 formulation changes. It's a combination of vitamins, minerals, phytonutrients, carotenoids, easy to swallow vegan capsule. So it's the latest in nutritional support for your eyes and your entire body with no beta carotene. I repeat, no beta carotene. If you have a vitamin that has lutein, zeaxanthin, or askthedr and beta carotene in it, they haven't thought that through. Beta carotene blocks the absorption of carotenoids in the xanthophyll family. That's lutein, zeaxanthin, mesozeaxanthin, and askthedr. So there's no beta carotene in it purposely. And we'll expand on that in a few more minutes, but we do have some people that want to ask us a question. Let's go. Give us the number one more time, 813-282-8283. If you got a question, give Dr. Summerton and myself a call at 813-282-8283. All right. Let's see Steve in Clearwater. Steve, good morning.
Yes, I'm going to add an official national holiday to the summer solstice, and that's going to be the Saturday before the summer solstice will be the Summerton solstice. So we have to honor Dr. Summerton every Saturday before.
The Summerton solstice.
Yeah. Anyway.
Thank you.
Yes, I think that's wonderful. One thing I came up with this week, which I think was very interesting, is I have come across a letter from the Office of the President of the United States, Office of Science and Technology Policy. It's dated February 3rd, 1920. and it's directed to Marcia Nutt at the president of the National Academy Foundation. It quotes a paper about uncanny similarities of the COVID virus to, there's 4 insets into the genetic code of that virus. Damn it, they knew this thing was produced back to February 3rd, 2020. And when I looked for the paper on the internet, it had been scrubbed from the internet. Now it's back on. But they knew almost immediately that this thing, and yet they constantly told us that it wasn't a produced virus. I got the paper right in my hand.
All right.
February 3rd, 2020, talks about the unusual evolution of this virus. Now, what does that mean? Genetic engineering. They didn't say genetic engineering.
We're not going to go there due to certain specific government entities that listens to the show.
Well, there's nothing there. It's right in front. Anybody can look it up in the internet.
Right.
And there's 4 inserts, and you can actually see where these inserts are in the code. Anyway, one thing about last week when I called, I talked about the lycopene and the prostate. Tomato juice is almost useless to get your lycopene because there's no water. It's all water. It's no oil or anything, so it won't absorb. For instance, if you spill tomato juice on a shirt, you can rinse it right out. But if you spill tomato sauce or something like that, or something with oil on it, it will stain the shirt. And it's the same way because of the solubility to go into the fibers. So anyone taking tomato juice to get their lycopene probably really isn't getting any. They need to have tomato sauce with some oil or something like that.
Or tomato paste or tomato sauce, preferably organic. And I've had a lot of patients, and there's indications that it works, that, have BPH, benign prostate hypertrophy, that take a cup of tomato paste or a cup of tomato sauce every day, and their frequent trips to the bathroom at nighttime are dropped significantly. And studies do indicate it lowers your PSA numbers. So men out there, if you're frequenting the bathroom at night, obviously talk to your physician or urologist, but it's not going to hurt you to try consuming some tomato paste, tomato sauce, maybe a cup a day. I think it's worked for me.
Yes, and the one thing that lycopene does, it's involved in a compound called connexin, which the cells are able, it forms a layer between the cells in which this cell can say, that cell next to me is cancerous. It's a communication aid between the 2 membranes of the 2 cells. It's really important. But anyway, I got a list of 10 other things, but I better stop it there.
All right, Steve. Thanks for the call, my friend.
Okay, bye.
All right, you're listening to Ask the Doctors. We're live in the studios this Saturday, the 7th of June, 2025. Dr. Susan Summerton and myself, Dr. Michael Lange. So give us a call at 813-282-8283. That's 813-282-8283. Also, I do want to mention before I forget, the only place in the country right now that you can get 50% off your Gucci frames, Saint Laurent frames, Mont Blanc, and here's a kicker, Cartier, 50% off is at the Lange Institute in the Villages, Florida. So if you're down in Miami or St. Augustine or Atlanta and you want a high-end frame, 50% off. There's no place I know of in the country right now you can get 50% off of these. So it's Gucci, Saint Laurent, Mont Blanc, and Cartier, 50% off while our supplies last. And we have thousands of those frames. So that's at the Lange Institute in the Villages, Florida, right there on County Road 101 and 466. You can't miss it. It looks like a big plantation on the Mississippi River. And you can learn more if you just simply go to drmichaellange.com or langeeyecare.com. So langeeyecare.com or drmichaellange.com. Also, you can follow me on social media. Instagram, a lot of you watching live on Instagram, is Dr. Michael Lange _, and we're getting close to 200,000 followers. We're building it back up after it was hijacked. Follow me on Instagram. We oftentimes will give a flash sale for Fortifeye vitamins where we give you a special code. And if you follow on Instagram, you can reap the benefits of dramatic savings. So Instagram, that's Dr. Michael Lange _. I have a blue check. There's 200 fake Dr. Michael Langes on Instagram. The only legitimate one is Dr. Michael Lange _ with the blue check. All right, let's go back to the phones. Let's see, Hugh in Ocala. Hugh, good morning. Welcome to the program.
Yes, good morning. Thank you. Say, I'm in my middle 80s, and up to a few years ago, I was religiously a treadmill person, and I developed arthritis in my knees and ankles and everywhere. And I do walk my dog, but it's an easy walk. Is there any kind of a medication or exercise I can use to get my heartbeat up, to stress my heart a little bit?
Yeah, I would do a recumbent stationary bicycle, all right? Because that's taking the gravity off of your hips, your ankles, and your knees. And you can get a really good cardiovascular workout and a great lower body leg workout, and even ab workout. Make sure it's recumbent. That's the one you sit back on, and it's stationary, and you can do it in the privacy of your home or at the gym. But the recumbent bike is the way to go for sure. And then you may want to consider, if you're not already on, our Fortifeye Super Omega and our Next Gen Curcumin. So the Next Gen Curcumin combined with the Omega-3, the Fortifeye Super Omega, really has a lot of really good natural anti-inflammatory properties. My dad was a rheumatologist, so he's an expert in this arena, and he helped in that formulation years and years ago and used to recommend it to a lot of his patients at Ochsner Clinic in New Orleans, Louisiana. So, and then obviously eating a diet kind of consistent with my Lange survival diet. I developed the Lange survival diet to be an anti-inflammatory diet. So try the recumbent bike, try Next Gen Curcumin and Super Omega, and adjust your diet. Eat more of the foods on the Lange survival diet. And I think you really will do quite well. And Dr. Summerton's an expert in anti-inflammatory diets and supplements as well. I think you want to chime in a little bit and add to it.
Yeah, and I agree. Everything.
Go ahead, Dr. Summerton.
Go ahead. Everything
say
is lowering that inflammation. And so that's part of the reason for the pain is the inflammation. So anything you can do to lower that, the curcumin, the omega-3, avoid all those foods in your diet that can cause the inflammation, the processed foods. Make sure you're getting enough protein. We tend to not eat as much as we age, and you're not getting enough of that protein to support that muscle buildup, and you're getting what we call sarcopenia, and then you don't have those muscle kind of strengthening around those joints to protect them. But you're doing the right thing. You're listening to your body and what it's telling you to do and taking the stress off the joints that's giving you that pain.
Right. Say, real quickly, how many heartbeats per minute should you have to know that your heart is working, you know?
Well, as long as you're pretty healthy, you know, at 82, there's an exact formula you can find on the internet, but I like to say, try to get your heart rate right around 100 or a little bit above 100. You know, don't overdo it. You know, every now and then you can do a little bit of a sprint and get your heart rate up, but, you know, staying anywhere from 80 to 100, I think is fine. It's just more of that long-term chronic kind of slow exercise. You don't have to be sprinting. You don't have to get your heart rate up to 130, 140. But I would say between 80 and 100, and then doing some little sprints and getting up a little higher. And do it for 30 minutes, preferably 7 days a week. And then the other thing, Hugh, is get a little sunshine. Don't be afraid of the sun, because vitamin D is a very potent steroid hormone, and it acts as an anti-inflammatory as well. And people that are vitamin D deficient are more prone to have arthritic symptoms and all sorts of other health problems. So a little sunshine here in Florida without sunscreen. So 15 minutes on the front, 15 minutes on the back, unless you're an albino. And that's a half hour of sun a day without sunscreen. If you're going to be out in the sun longer, then you probably need to cover up or use some sort of good sunscreen. But the vitamin D is important as well.
Okay. Thank you very much.
All right, Hugh, you take care. Good luck. All right, you're listening to Ask the Doctor. Is Dr. Michael Lange of the Lange Eye Institute and Fortifeye Vitamins, and my co-host, Dr. Susan Summerton. Give us a call at 813-282-8283. That's 813-282-8283. And we started noticing years ago when we started prescribing omega-3 for our LASIK patients prior to LASIK surgery, then we noticed the ones that were athletic and had rheumatoid arthritis and osteoarthritis and my elderly patients that elected to have LASIK surgery, we found out that they had less symptoms from their arthritis. So we were pre-medicating with omega-3 so their dry eye would be reduced prior to LASIK surgery. So there is definitely validity on consuming more omega-3. And there are many studies out there. Everybody's trying to say that omega-3 isn't good for you. And I chime in on all these doctors that are just trying to get hits and likes on social media. So many studies, the Ascend trial, the Vital trial, the Reduce It trial. There's a lot of studies out there that show that increasing omega-3 in the right form is advantageous for your health. So remember the right form. I always tell people to test your omega-3, squeeze the contents in a styrofoam cup. If it rots a hole through the cup in 5-10 minutes, that means it's an ethyl ester molecule, has ethanol attached to the backbone. That's a very inefficient form. It's very cheap to make. Goes rancid very quickly. It's very unstable, doesn't absorb well. So you want it to say TG form on the omega-3 or RTG form. And there's only a few good brands out there, but Fortifeye is one, Fortifeye Super Omega and Fortifeye Super Omega-3 Max. All right, we're going back to the phones. I think it's Matt in Trenton. Matt, thanks for holding. Good morning.
Good morning. I've had over the years, I'm 67, I've had over the years several bouts that last quite a while of blepharitis. And I'm just wondering if there's something that I'm not getting in my diet or is this just something that pops up every once in a while?
Wow, that's a great question. I'm gonna let Dr. Summerton chime in on one form of blepharitis called Demodex blepharitis, and I want her to expand on that, and then I'm going to chime in as well.
Okay.
So a lot of it depends on what type of blepharitis you have. A long time ago, we used to just treat it like it was bacterial blepharitis, and we just kind of used to say, use the baby shampoo and wipe your lids and clean your lids. But research has shown, along with just us trying to get better, because we used to say once you have blepharitis, you're kind of stuck with it. But now the most common form that we are identifying and we see every day in clinic, it's very common, is what we call Demodex. And that's a little form of a mite that can actually get in the eyelashes there. And we can see it under the microscope. And the best thing we know of to do that, they've taken years to kind of figure this out, is tea tree. So there is actually these wipes that are made. You don't want to use straight tea tree on your eye. That would really burn. But it's the active ingredient in tea tree that they've put in. You want to do that twice a day, and you need to do it for a full 6 weeks at twice a day. If that's not enough, there's actually a new medication out there. It's an eye drop called Zemdevi. That's a little bit hard to get. You have to kind of work with the right doctor and right pharmacist to be able to get it. And it's the same treatment of twice a day for a full 6 weeks, because we need to go through the full cycle of the Demodex to be able to kill it off. And sometimes as we kill it off, you get kind of all the dead cells. It makes it get a little bit worse before it gets better, but that's sort of a sign that it is working. But we put patients on this program, and along with warm compresses too. And in 6 weeks, their lids just look so good and are back to normal. And it is good you get on top of it, because blepharitis is inflammation along where the eyelashes come out of the eyelid. And if your inflammation is going on too long, you've got little glands around there, and those can get inflamed, and then you end up with chronic dry eye in the long run. So it is something you kind of want to take care of, along with, you don't want to live with this discomfort. And we do tend to find you're more prone to styes and chalazions too if we don't take care of that.
And I think,
so the ones out. Go ahead, Dr. Lange.
Yeah, and I think, Matt, also, adjusting your diet. I mean, you might already be on the perfect diet, but, most Americans are on what we call the SAD diet, the standard American diet, which is pro-inflammatory. So I created years ago something called the Lange survival diet, and you can Google that, just Lange survival diet. It will come up, and it tells you the good foods, versus the bad foods. It gives you a list of foods to eat. So next time you go shopping at the grocery store, just print that out and only buy those foods. And that will indirectly help because remember, it's inflammation. That'll help inflammation in the meibomian glands. It will help with dry eye. But I agree, the hot compresses, either OcuSoft Dimidex Oost lid cleansers or Optase Tea Tree Oil lid wipes. And you can learn more about those at our website at fortifeye.com. Go to the eye care section and you can read about those. You can even order them on there. But the lid hygiene, the hot compresses, and the diet, and you should be able to get this under control. If it doesn't get it under control, then like Dr. Summerton mentioned, you may have to get this prescription medication that's sometimes difficult to get. We can get it. It's almost an act of Congress, but we're happy to see you down in the Villages at the Lange Eye Institute anytime.
Okay. So I just got done with a 10-day course of eye drops and antibiotics. And so it's kind of cleared up. The whites in my eyes aren't quite as white as they, I think, should be. But other than that, I'm feeling much better than I did just, 2 weeks ago.
Now, was that a topical antibiotic or an oral antibiotic?
Oral.
Yeah. Was it doxycycline?
Yes.
Good. Yeah, so doxycycline is good for the meibomian glands. It lowers inflammation, kills off the bacterial flora. And if this is related to bacteria, you will get better. If it's related to Dimidex, it's not going to help much, okay? So that's why you may want to try those lid scrubs that we discussed in combination if you're still not getting perfect.
Okay, well, I'll give it another 2 weeks and see how I feel, and then I'll head to the website and see what I can get for this.
Keep us
Thank
posted.
you very much.
Keep us posted.
I will.
All right, you're listening to Ask the Doctors.
Those tea tree wipes I use quite frequently just as maintenance on myself. I love, ladies will like it. It helps get makeup off those nice little tea tree wipes. But I use them just as a preventative, and just because I'm around it all the time, I just want to stay on top of it. And I love those little wipes.
Right, and they're refreshing. You can actually wipe your whole face with them. So it is. And the one that we're talking about is called Optase Tea Tree Oil lid wipes. And like I said, you can learn more about it and you can see it on the website at fortifeye.com. That's FORTIFEYE, fortifeye.com. If you'd like to see Dr. Summerton or myself for an eye exam and with a nutritional twist, you can call the Lange Eye Institute in the Villages. Let me give you the phone number. I'll give it to you twice, so get a pen and paper. It's 352-753-4014. That's 352-753-4014. Or you can go to langeeyecare.com or drmichaellange.com. Also, I'm going to give you the phone number before we take the next call for Fortifeye vitamins. And the phone number Monday through Saturday, I think they answer the phones till 3 o'clock on Saturdays. The phone number is 866-503-9746. That's 866-503-9746. If you're in the Tampa Clearwater area, we do have the Fortifeye Nutrition Center here in Clearwater, right on McMullen Booth Road, right in the Bayside Bridge Plaza where Publix is. It's Fortifeye Nutrition Center. You can't miss it. We have the entire line of Fortifeye vitamins and a lot of other stuff. Plus, we have all of the eye care drops and wipes and things there as well. That's Fortifeye Nutrition Center in Clearwater. And then the Lange Nutrition Center in Ocala. It's in the old Lange Eye Care building, 2-story building right on State Road 200. You go up the elevator and the Lange Nutrition Center is there. We have all of that there as well. All right, we're going back to the phones. Let's go to somebody in Sarasota by the name of Jacqueline.
Good morning.
Good morning.
I purchased your Fortifeye Super Omega, and I'm not able to swallow it. And I'm wondering if you could recommend, if I cut the end off, what kind of food should I put in to take it?
All right, so I made it where you can bite into it with the back of your teeth, your molars. You just bite into it and it squirts in your mouth, kind of like the Freshen Up gum, remember in the 80s? So,
right.
And it's got a lemon flavor, so it doesn't taste bad at all. My youngest daughter and my 97-year-old mom does that. She just bites into it, squirts in her mouth, and it discards the gelatin because it is, as you know, it's a big gel cap, right?
Right.
And so some people can't swallow it, or you can just snip the end off with scissors and just squirt it in your food, and any food you want, just squirt it in there. It's not an unpleasant flavor at all. Like I said, it's lemon flavor. But then you're going to get
Like applesauce or something like that.
yeah, you can put it in applesauce or tomato sauce or, you know, your grits in the morning if you eat grits.
Well, thank you very much.
All right, Jacqueline, take care.
I
I am glad she's taking the omega-3. I'm pretty famous for saying if you only took only one supplement, it should be a good reestified triglyceride or triglyceride form omega-3 because that has so many health benefits. And you can go to a website and this will show you all the health benefits. And it's called healthbenefitsofomega3.com. So healthbenefitsofomega3.com. It has all the latest studies. The studies are all within the last 5 years, proving the benefits for all aspects of your health. And I think, Dr. Summerton, omega-3 is one of the major supplements that we recommend to our patients.
It is because just by definition, omega-3 is an essential fatty acid. So there's not a single person out there that doesn't need that in their diet. And that's the problem too. We're just not getting enough of it in our diet. We want you to eat the seafood, the fish, but it takes the fatty, oilier fish at least 3 times a week in your diet to do it. I know myself, I'm a big seafood fan, so I do eat a lot of seafood, but I still take it on a daily basis because of the benefits of it. I want that anti-inflammatory property going into my body. I want it to feed what we call the DHA part of it. I want it to feed my brain, and I want it to get into my retina. I want it to have the EPA that's going to help my heart, and I know that it's doing that. And so a lot of people, it's just understanding the benefits that kind of motivates you to take it, because it does involve, again, a little bit of extra. You got to remember to take it, but you will reap the benefits, and it's a long-term investment in your health.
Yes, it is. And we're getting ready to take another call, and we're going to take a few questions here on the internet here. But if you got a question, give us a call at 813-282-8283. That's 813-282-8283. Before I address the question on ocular rosacea, I just want to finish talking a little bit about the multivitamin eye vitamin that we developed called Fortifeye Complete Advanced Nutrition. So remember, this is a combination of over 20 years of research. 17 formula changes have gone into this. And it's the latest in evidence-based nutrition to target the eye and the entire body. So it's an eye vitamin and a multivitamin. And I'm just going to briefly run through what's actually in this, all right? So it is all the vitamin C, vitamin D3, the 8 forms of vitamin E, B complex, and the methylated forms, all right? Chromium, bilberry, acetyl L-carnitine, alpha-lipoic acid, resveratrol, black currant, curcumin, taurine, pine bark extract, CoQ10, grapeseed extract, the newest form of macula of lutein and zeaxanthin made by Chemin Industries called MacuLZ, saffron, and of course, astaxanthin. That is all in this. It's a one multivitamin. You take 1 to 2 a day based on your weight. If you're 180 pounds or less, 1 a day, 180 pounds or more, 2 a day. If you've got lots of chronic issues, probably 2 a day is beneficial. And you can take up to 3 a day as well. All right, but there's a question here that Dr. Summerton can help answer also. What's the fastest and safest way to treat or heal ocular rosacea? And this is from Cynthia on, I think, Instagram or YouTube. What do you think about that, Dr. Summerton?
Well, we already kind of brought it up in similar ways that we talked about with the other caller with the blepharitis. The rosacea also can benefit from that active ingredient in the tea tree. And like we mentioned before, you don't want to put direct tea tree oil on your eyes, but those wipes, the Optase with tea tree, the Alps with tea tree, those are going to have that benefit of reducing that rosacea symptoms for the eyes, and the hot compresses too. And I want to bring this up. My dear patient actually brought this up to me yesterday. She's a big listener out there, Hygiene. She mentioned to me when we talk about warm compresses, she said about using tap water. Well, when we talk about warm compresses, we sometimes forget to mention this. We're talking about the warm compresses that you buy, those little eye masks that you heat up in the microwave. You don't add water to them, and they stay warm for 10 minutes, hot enough so you feel the heat, not too hot, you want to pull it away. Or the ones that you can plug in, and they have little timers on them, and you set it for 10 minutes. You can put it on low, high, again, to what is not too hot for you, because we want it to heat up to dilate all little tiny blood vessels in your eyes. And so it's not just taking like a warm washcloth, putting under hot water under your eye, because unfortunately tap water can have contaminants in it, especially amoeba, and we don't want that getting into your eye, especially our contact lens wearers for sure. So I know I just heard of a person that used tap water as a nasal rinse and ended up getting an amoeba in their sinuses. And so it is something to think about. You want to kind of stay away from that tap water around your eye.
Right. And then also for the ocular rosacea patient that is asked in that question, low dose doxycycline, your doctor can prescribe, or you can come see us at the Lange Eye Institute. Low dose doxycycline sometimes helps for a period of time, a couple of weeks up to a month, to help open the meibomian glands and lower inflammation and kind of get rid of some of the bacteria that could be clogging the meibomian glands, which is very prevalent with ocular rosacea. Omega-3 is also beneficial, and there's some good studies out there taking a good omega-3 like Fortifeye Super Omega or Super Omega Max 2 per day to help with ocular rosacea. Remember, if you're on an antibiotic, you got to take probiotics with it or eat some fermented food. And then lastly, we get some great results. I'm talking incredible results with our OptiLight IPL machine. That's intense pulse light therapy. A lot of these patients with rosacea have these little blood vessels that grow into the meibomian glands, and you can see it on the lid margins. It's called telangiectasia, and the IPL can treat this quite well. So if your eyes are really dry and you have blocked meibomian glands, consider seeking out a doctor that does intense pulse light therapy. And then finally, this is a lot we're throwing at you, the lid scrubs that Dr. Summerton talked about, the Optase tea triol lid wipes are also good to rub all on your face, on your cheeks and your nose, all around the eyes. That can help with rosacea as well. Demodex is a big culprit that can aggravate rosacea as well. So we covered a lot there. You might want to go back and watch the tape of this on our YouTube channel. That's Dr. Michael Lange Ocular Health channel. And it'll be posted about, 3 hours after the show. All right, we're going back to the phones. Let's see. Karen, I think in Sarasota, has been waiting patiently. Good morning, Karen.
Hi, how are you? I really love your show, and I'm really appreciative that you have this topic on.
Thank
I
you.
actually just ordered the wipes, but I have a chalazion. I've had it for over 3 months. Started out as a sty, then I had it treated for the sty. Then I went to a doctor who gave a steroid to the chalazion. It didn't help. It's still there. I'm contemplating getting it removed, but it doesn't really hurt. It's just really annoying. I don't even know how I got it, but I mean, I'm just like at my wit's end with it pretty much.
Right. So cosmetically, it's not appealing. It's a little bit of a nuisance, isn't it?
Yeah, I mean, it's not huge. You can't really see it. It's just I feel it. I
Right.
feel a little pebble in my upper eyelid.
So Karen, when we get to the point where, you had a sty and now a chalazion, and it's just not appealing to you, there's a couple of options. A, obviously you can have it surgically excised, but we've had great success with our IPL, with the OptiLight IPL. We put a special contact lens on your eye that's opaque, so the IPL doesn't get into your eye. And we take that IPL with a special little device designed for the meibomian glands, and we zap it about 5 times. All right.
Wow.
And
Yeah.
we've had amazing success, and there are clinical studies that prove that that works. That is not covered by insurance. It's about
Right.
a little over $300 to do it.
Okay.
But if you don't have to have surgery, then that may be a very well spent $300,
Yeah.
because surgery
Sounds
isn't
good.
without inherent risks, as you know.
Yeah. Of course.
So that's
Yeah.
something to think
Great.
about. You can go
Thank you.
and see if there's any doctor in your area that has an IPL machine that's willing to
Okay.
do it on the chalazion. If not, you can come see Dr. Summerton or myself at the Lange Institute,
Wonderful.
which is just a
Okay.
hop, skip, and a jump from Sarasota.
Yeah. Yeah. Thank you so much. I really appreciate it.
All right, Karen, you take care.
Have a good day. Bye-bye.
Bye-bye. And oftentimes we'll actually start patients on a course of doxycycline prior to this as well. And sometimes that's beneficial depending on the size of that. So, Dr. Summerton, we really are finding a lot of great uses, for the IPL, aren't we?
Right. And like she mentioned, those chalazions, we've struggled with treating those over many, many years, because when people get a sty, all those cells can kind of get trapped, and those meibomian glands can get clogged. And because there's not a lot of those blood flow in the eyelid, they are really hard to get rid of. And we used to have to send people for surgery to get that cut out. But the fact that we have this option now, non-surgical, no downtime, no scarring, it's just such a great option that we have, that we can additionally help patients with it.
And here's the key also, painless. All right. Nobody likes pain. So we've also been getting some incredible results. So with our dry eye patients, and a lot of you that are listening have chronic dry eyes, right? Your eyes feel sandy, gritty, burn, tear, itch. You've tried just about every over-the-counter drop, every prescription medication. You've done lid scrubs and hot compresses. You might have had punctal plugs done. You might have even had amniotic membranes put on your eyes, stem cell membranes, all sorts of things you've tried, and yet your eyes still feel sandy, gritty, burn, tear, itch. And a lot of you are putting drops in really frequently. I'm talking, I've had patients every 20 minutes putting lubricants in. Otherwise, they almost become crazy. Dry eye is a big problem, especially as we mature. And oftentimes, the majority or the lion's share of these dry eye patients are related to meibomian gland dysfunction. That's where the glands get really clogged and nothing is coming out. The most crucial outer lipid layer of your tear film is deprived because it's not coming out. And people with age, with Demodex blepharitis, with rosacea, all right, poor diets are all more prone to getting this. And that's where the OptiLite IPL comes into play. And if you want to find a doctor that's doing it, you can go to their website. It's Luminous. I don't know if it's luminous.com, but Luminous is the manufacturer of it. They have a doctor locator on there. If you have IPL, I like the Luminous OptiLite because it is the only one FDA approved for dry eye treatment. And they're the ones that had invented the IPL for dry eye. So we do have it at the Lange Institute. It's a procedure that ultimately you have 4 treatments done. The treatment itself takes about 10 minutes. It's painless. Like I said, Dr. Summerton and I have done hundreds of these, and we're finding at the first 1 or 2, you get a little bit of relief, but the magical number seems to be 3. The third treatment, patients are really starting to notice a significant improvement. And the 4th treatment is kind of like icing on the cake. So, Dr. Summerton, just doing it once probably isn't adequate for this condition.
Right, and that's when we put people on the program. We do 4 treatments, and we like it 2 weeks apart because of having the best effect. But that we understand that one is not going to do it. And so it takes that repeat treatment, and it's additive. So each treatment, it gets better and better. But like you said, it's usually by about the 3rd treatment that they start to notice that positive difference. In effect, but that being said, I've actually had patients that do notice it after 1 treatment as well.
Right. And if you're interested in having the OptiLight IPL treatment, you can call the Lange Eye Institute. I'm going to give you the phone number twice. It is 352-753-4014. That's 352-753-4014. And then oftentimes we have a different attachment, and we can go down a little further on your face to help lower inflammation in the face that causes inflammation in the meibomian glands. That's kind of like a photofacial. So there's a little bit of a benefit aesthetically as well. Also, I do want to mention we are going to manufacturing for Fortifeye Fit Meal finally. Fortifeye Fit Meal, we're going to manufacturing. It's going to be a couple of months before we have it, though. So that's kind of exciting. And also, the chocolate super protein from New Zealand should be in this next week. Dr. Summerton, you got to tell everybody goodbye.
Wishing everybody a blessed day. Go out and have a healthy day.
All right. I'm out of here. Have a great day. God bless you and God bless America. See ya.